And I want you to see our website for the school. I'm sure if you did see you booking online stuff, you clicked on continuing education, but we're going to talk about some COVID-19 stuff. So hover over about. We're going to click on COVID-19 written plan just so you see where to find us later. I'm going to go through and read some of this out loud and discuss it. So we're going to start with this before we get into everything else. You can go ahead and start writing down some points of sanitation because this is a little bit different. I think the biggest thing that we've all learned this year is how to go above and beyond with sanitation, which I have to say that's probably the more positive thing in our industry that has occurred is that we've kind of looked at ourselves internally to say, well, where can I be better? How can I tighten things up with sanitation? What do I need to do differently moving forward forever with clients? And whatever the case may be, right? So I think that's a positive change. I really, really do. And I know you think so as well. So here is what I want to show you. Look how long this is. Number one. Okay, what I want to show you is the fact that you are more than welcome to copy paste this exact thing onto your website if you're a spa owner. I think that's important. This is going to be something we deal with for a while. It's not going to end right now, right? So we need to make sure that it's on our website and then clients understand and employees of yours, right, understand that you take things seriously in regards to sanitation and safety. One other thing before I get started too is I actually have a whole folder in my email system where my teachers for day and night class or advanced aesthetics program, all that, they take temperatures every day with their contactless thermometers, and they email me student temperatures every day, and I keep that. I keep that in a folder. That way, if there were to ever be a question, we can say, no, 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 I checked Susie's temperature on this day, and here is what it was. So for those of you that are bringing in clients, or bringing in employees or both, I highly recommend you keep some sort of a log. That is my professional suggestion to you pertaining to the day, their name, when they walk in the door, what was their temperature that day. It is important to make sure you have proof documents on everything. And as someone that has gotten a school nationally accredited by myself and written plans or everything, this comes naturally to me now. And documentation comes naturally to me now, but organization documentation is very key to the longevity of any business. I'll tell you that's the fact for sure. Okay, so here's what it says. It says we've instituted safety guidelines for employees and clients to follow in the midst of COVID-19. Student guidelines, and again, this is for our students, but you can change this for employees if you would like. Students are required to have their temperatures tested daily prior to entering our facilities. Students are required to wear masks when performing services on each other and members of the public. That is a very hard, absolute fact that happens at the school, and we're just all used to it at this point. I'm sure you are too. Students are required to wear gloves when performing services on each other and members of the public. That has always been a thing that we've done at Southeastern, and I highly recommend it become part of your norm. And if you need to add $1 or $2 additional per service price point moving into the new year because of all these disposables we have to purchase now, and you want to buy the nice nitrile gloves and whatever, do that. You have to do what you have to do for your business. I think that's important, but just make sure that you have these things, and PPE is top priority, right? Students are required to sit 6 feet apart in all classroom areas. Where spacing 6 feet apart is not possible, students are required to wear face masks. It is heavily encouraged that all students and staff members take measures to receive testing for COVID-19. So that's very important. I think that statement is important in your spa too. Okay, and I speak to most everybody like an esthetician, even though I know some of you are cosmetologists. When you're going to be close quarters, it is highly recommended that you wear a face mask when being in close quarters. When you are separated by 6 feet, you don't necessarily have to wear a face mask, right? But when you're going to be close enough together, that face mask is required. And when working with the public, when working with other staff members and coworkers and colleagues, you have to obviously be realistic. You're going to be closer together than you think. So make sure you wear those masks at all times and you're good to go. All right, then. Client guidelines. I think this is important to make sure to address what each person needs to do and what they're responsible for. And you can even copy and paste this on a piece of paper, print it and put it in an acrylic display on your reception table, right? We want the client to feel comfortable when choosing to receive services at SEI, or of course your business, you can change it to that. However, we're taking serious precautions to ensure your safety, to include the following. If the client has any symptoms, stay home and contact a doctor, local health department. SEI will be taking the client's temperature upon arrival, right? We're going to maintain separate waiting areas where social distancing can be easily maintained, and or ensure the client is directed to their designated treatment area as soon as they arrive into the facility. So if you've been to our facility, and good Lord, I'm in the midst of putting together 30,000 square feet of new space that we're doing construction on right now on Main Street. So literally, we're just so busy, it's not even funny. I can't wait for y'all to see that. But right now, y'all know that we have our downstairs spa, upstairs on the second floor of one of our buildings. We have got our advanced clinic, and Dr. Carroll and Dr. Baxley and I have worked very hard to make sure that social distancing for these appointments is key. So we'll have folks that sit in the waiting room. And then of course, if there's not enough room in the waiting room, we want to make sure that distance is possible. We'll make sure there's an open room for the client to go ahead into a treatment room to fill out their paperwork. That way the clients are maintaining their distance. And of course, everybody's wearing their masks anyways. All right. Then the clients are required to wash their hands upon arrival. We ask that the clients arrive alone for their appointment and do not bring any children or guests into the facilities. And I know this is a big issue for most of you in the past. So of course, this year that probably has helped a good bit in, bringing guests. Hopefully they're not bringing any guests with them. Service guidelines. If the provider has any symptoms, stay home and contact a doctor or local health department. That's been the biggest thing. We've gotten phenomenal with this year. If our students or employees feel like they are coming down with something, stay home. We do not want you to come, right? And it's just one of those things. You've got to stay on top of this and be diligent and ethical in every moment of your practice as an esthetician or cosmetologist. It's just so important. It's just so important. Avoid touching your face, even with gloves on. I'm going to say one thing real quick off to the side. I mentioned this to our advanced students the other day. I said, the dirtiest thing that you have are your cell phones. Do not bring them in any of the treatment rooms when we're working together doing microblading or whatever it is we're doing, right? Leave your phones over there. You cannot put on gloves, hand sanitize, and all that kind of stuff, and then touch your phone. That is not going to work for me. And you need to make that a very big, clear thing for your employees as well. I know a lot of you want to do before and after pictures, but there needs to be a designated space for that. Preferably not your phone either, maybe a specific iPad that you've paid for, as a business expense, and it's out in the lobby or somewhere off to the side outside of the treatment room. You take the picture, you of course hand sanitize the actual picture taking device, camera, iPad, whatever, and then go into the treatment room with your client, wash your hands, hand sanitize, glove up, hand sanitize again, all of that. So keep those things in mind. It's going to become so second nature the more you do it. And I'm sure you ladies, and there might be some guys on here today with us too, I'm sure you've already come into those particular things and you've got your routine down. But for some of us that still aren't serving clients yet, just think about these extra things and think about putting all this on your website too. All right, then have multiple sets of tools, supplies, and linens available to speed up the treatment room turnaround. And then backing up really quick, communicate with clients about cancellation notice as well as what the provider's disinfection procedures are. That's important. Communication is so key. If the provider has access to an autoclave, use it for all metal implements and tools. You'll hear me talk about infection control all throughout these lectures, and an autoclave is not required, right, by the Board of Cosmetology, but it is required that you have it spore tested every 30 days by an outside entity if you choose to have one. Now, I am on the task force for the Board of Cosmetology, not on the board itself, but as part of the task force, me and one other individual, we actually sat through a couple little meetings right before the quarantine hit, and we went over sanitation rules and regulations, and just, gosh, y'all, in my opinion, it is just so important. I am just thrilled that we can add these additional things and be more diligent than ever. To me, that just brings the professionalism and standards, set that standard for who we stand for and what we stand for as estheticians, cosmetologists, and the entire industry. So that just makes me very happy, and I'm sure it makes you happy too. All right, then it goes on to say, Prior to service, clean the room, make sure everything is wiped down, of course. Look at my 3 steps. Y'all know I love these steps: decontamination, disinfection, sterilization. I'll talk through a bunch of that later, but just keep in mind that decontamination, disinfection, sterilization is everything. So when you are training people like front desk providers or new employees or people that might not even be licensed, like your front desk providers, you need to make sure they sign something stating that they understand sanitation rules and regulations, because they work for you. They work in a licensed salon. So it's required of them to know. Just because they're not licensed doesn't mean they shouldn't know these steps, right? Then, of course, wash your hands. And of course, my nose is itching. I apologize, but I've been washing my hands all day. I'm sure you have too. Use a disposable towel to dry hands and discard in a closed trash can. Wash your hands for a minimum of 20 seconds. When using alcohol-based hand sanitizer, allow it to dry for a minimum of 20 seconds. I think that's important. A lot of times now, we're using either handmade hand sanitizers or alcohol-based hand sanitizers, and they smell special, right? And all that kind of stuff. Make sure we spray it on after you've washed your hands. You allow it to dry for that 20 seconds and then move on to do whatever it is you're going to do. Of course, my suggestion is to put on gloves, hand sanitize again. Then make sure you set everything up and then keep to yourself. Do not shake hands or touch your client when initially greeting them. I think we've gotten used to that, although it's been difficult. We're in a society and in a field where we provide customer service. We want to hug our clients. We want to make sure that, touch is a thing, but let's make sure we don't overstep our bounds, especially this year. And sanitation is happening or has happened before you touch that client and that sort of thing. So we do lots of elbow taps, right? And that's okay. That's very normal now. All right, during the service, wear gloves. Again, nitrile gloves are my favorite. They are latex-like yet latex-free, so no allergic reactions. Wear a mask. Masks must be worn during the service, okay? The goal of this is to protect your client from respiratory droplets that you can spread regardless of your infectious status. Consider wearing a face shield if a mask is unavailable. Be sure to fully disinfect it after use. That is a big thing. Not only for face shields, but you need to think about your mag lights and just the reflective surfaces. Anything that you touch, and one of my biggest things is the hot towel cabinet. Make sure you wipe down and disinfect not only the inside of it, but the door handles too. Make sure you think a little bit more into every little thing. You'll be just fine. Then it says porous and non-porous supplies. Be sure to discard porous items immediately after use in a closed trash container. Very important. I just on Friday filmed some more content for I think it's November 11th or 12th, whatever that Thursday is coming up. I'm doing an aesthetics equipment CEU. So I've got some RF skin tightening that if you're hopping on that one, you might enjoy watching that. And then of course the hydrodermabrasion stuff and some other modalities. We're going to do micro channeling, which is really great and within your scope, right? Between the 0.25 and 0.5 depths. But the big thing there that I called out is to make sure you have a foot pedal trash can. So I showed that on camera. I foot pedaled, I put my trash in there, I hand sanitize, go back to what we're doing. So just make sure you think of it all. Think of everything. All right, dispensing products. Do not dispense the product directly under the client's face from the container. Nobody really does that, I don't think, but this was a cool suggestion I saw, so I added it. Instead, place products into a small bowl before placing it on your cart. That's important. Then we have a ton of students. Y'all know I own an aesthetic school, so we have a ton of students that come from different backgrounds, and a lot of folks that just started with us last week, they have worked for all these different makeup counters, and we discuss sanitation and what people do and what they used to do versus kind of what they're trying to do now. Again, glad that these standards have finally come out as the most important thing ever, because y'all know we've talked about this. If you're an alumni of mine, you cannot go to a department store anywhere and not see something happen that's a sanitary issue. So nowadays we got to make sure all those testers are covered. We need to make sure we're cleaning those makeup brushes and we're using disposables whenever available. So you see that here. It says use a spatula to dispense color onto a palette. I get with my students a lot. We do a bunch of makeup stuff. We've done body painting last week. I don't know if you follow us on Instagram and everything, but Listen up. We scrape out pallets. And I tell the students, do not bring your pallets from your home if you don't want to scrape them. Because when you're in the school, you're going to have to scrape out your pallets because that's how you do it for state board. That's how you got to do it in aesthetics forever moving forward. Get used to it, right? Do not work directly from your tester. So scrape out. Never use the back of your hand to mix color or test before applying. I don't think you guys do, but some makeup artists do that. Use disposable brushes whenever available. For brushes that are non-disposable, do not reuse on the next client. Completely decontaminate and disinfect after each use. Once dry, place in a dry covered labeled container. So again, I am so excited that we're moving to this new space, right? So I just sent this giant email to my staff last night and I told them, I said, okay, this week of December that the students are doing digital learning, we're all going to go and we're going to label everything. We're going to do new disinfectant spray bottles, new hand sanitizer spray bottles, all the things, because I love labeling. I love a label maker and I'm excited that the whole staff is going to get together and do this, right, for this new space. You need to make sure you include your entire staff too. Don't be the only one that sets all this up. I think that's one thing I've had to learn over the years is how to delegate and include everybody. Once they see how important it is and they have done it and they've actually put together the spray bottles, they themselves have helped you label things, they're going to understand. It's one of those things where you have to learn how to be a little bit of a teacher and put people into these places and these roles so that they kind of have some sort of an ownership over what's going on, right? And then after service, the laundry, right? You know, as estheticians, we are all about some laundry, whether we want to be or not. But it says here for linens, immediately remove all linens and place them into a closed hamper or directly into the washing machine. The provider can do this after the provider has escorted the client out of the room. Again, you need to make sure you have your hampers that are covered and you don't need to leave dirty linens in the room. Just go ahead and take it to your laundering area, take it out of the room. It's just not a nice thing. So make sure you have a hamper in the room, but you just take everything over, bring your hamper back, all good, right? It's even brownie points if you take your Lysol or something and spray inside your, little hamper that's covered too. Then disinfect all work areas, follow appropriate disinfection procedures for tools and devices. So important. So generally follow these steps. Clean non-porous items with antibacterial soap and water. Y'all know that's our decontamination step, right? Immerse an EPA-approved disinfectant for your contact time. That's your disinfection step. Remove, rinse, dry, and place in a closed container. That can be your stopping point, but y'all can go one step further with the sterilization step, which is autoclaving if it's a metal item. Then it says discard porous items immediately into a closed trash container. Wash your hands. After the service is concluded, wash your hands following the recommended guidelines previously stated. This can be done after the checkout is complete. You see, this is a lot, right? I hope you all are getting very excited. Sanitation should be everything. People look at you differently when you step up your compliance game. I'll say that one more time. People look at you differently when you step up your compliance game. In fact, most of you really enjoy when I teach marketing classes and stuff. Get on your social media, take a picture of how nice and clean your dispensary is, and maybe discuss some of your sanitation guidelines. That really is what it's all about. Those are the subliminal messages that make your clients want to come back more, is that you care about sanitation, you use it in your marketing, you live it, you breathe it, it's what you stand for. Why not do that? Why not do that? Step it up. Then environmental guidelines, it says here, cleaning devices, make sure you wipe everything down. This is a big thing. We're so focused on maybe hand washing or kind of our area, which is the treatment table and maybe even the counter, but we need to pay attention to the modalities we're using, right? Microdermabrasion machines, not just the wand, but the whole machine. You've got clients that can actually take droplets from your nose or their mouth, and it will get on your items around the room. You've got to wipe down every little thing, okay? Then client contact, electrodes, chips, anything else, we know that we need to disinfect those items, okay? Mark it clean. After fully cleansing the entire device, place it in a closed container, marked clean and disinfected implements. So I would absolutely love it, truly, if you all would today or at some point this week, take a picture of your dispensary area, your wet sanitizer and your organized implements, whether it's a clean, disinfected or, soiled implements. Shoot me a text. I would love to see the pictures of your sanitary areas. Gosh, that would just make me so excited. So make sure you do that. If you're available to do that today and you're in your spa, send me a picture because we need to all hold ourselves accountable. I would love to do a big old thing on social media showcasing everybody's areas because this is what we stand for. I think we all got a little bit frustrated in the spring, right? With the fact that our industry was looked at the way it was. And it is because it was close contact. It wasn't anything more than that, right? However, we demand some respect in this area. We all went to school for sanitation, and that's what you're here to learn how to do again. That's why CEUs even occur and exist, is sanitation. So just keep that in mind. Send me a picture if you can think about it. And one thing I'll say and pause on real quick and telling you that in 2021, and I don't believe this is out there yet on the LLR website, but it will be, is in March of 2021, everything is changing for CEU credit, okay? So in March 2021, everything is changing, and here's what's changing. You are now, okay, right now, you're getting either your 6 hours or your 12 hours. You're either, doing your first class, or this might be your second class this year in order to wrap up for your, to renew your license in the spring. That's fine. But after March of 2021, no longer will you have to do 12 CEU credit hours. So I've had my thoughts on that, but it is what it is. And I've got some really fun and exciting things coming up for that, that are inclusive of some other things that y'all have been excited about. But here's all that's required for CEU credit in March 2021 moving forward is it's only going to be 1 4-hour sanitation CEU class every other year. That's it. No more modalities, no more this, but you know me, I'm going to include it to some extent, but 4 hours. So 1 4-hour class of sanitation every other year. That's it. If you have any questions on that, shoot me a message. I'll try to check the chat box once we get y'all going with your other videos today, but keep that in mind. There's all sorts of changes happening here. Okay, then I see some people doing chatting. All right. Can y'all hear me okay? I've got my volume up all right. I saw someone said something about volume, so just make sure to turn yours up and you should be good. My volume is all the way up. Okay, then it says mark everything is clean. Steamers, empty your steamer at the end of every day. That is so important, right? Empty your steamer at the end of every day. Thank you, Angela Inman. You can hear me. I appreciate that. Okay, then hot towel cabinet. This is the one that drives me absolutely insane. And y'all know, if y'all know me, you're probably laughing because you've seen me get upset about this one. So hot towel cabinet, disinfect the interior of your hot towel cabinet and leave the door open to dry. So in LLR sanitation rules and regulations, it only just pertains to disinfecting inside and outside of your hot towel cabinet, but no one discusses the water catch tray. And that one is the thing. Y'all know what I'm talking about. That water catch tray at the bottom of the hot towel cabinet, it gets water in there. So it's going to cause some sort of mold or something if you don't pay attention to it. Don't just leave it in there. Make sure you pull it out at the end of every single day, take it over to your sink, decontaminate, disinfect, and take it and turn it upside down and place it on top of your hot towel cabinet to dry. And then in the morning, just scoot it back in, you're ready to go. But people do not do this one. So make sure you're checking that one. Make sure you're checking that one. The water catch tray is the one. All right, waxing services. Use a wax collar and dispose of it after each waxing service. Never double dip. I could talk about waxing all day, but you'll hear that at the end of this class today. We'll get into that a good bit more. Cleaning surfaces. Disinfect. While cleaning the surface, spray it with an EPA registered hospital grade disinfectant. That is so important. Again, make sure you put your 1/4 concentrate to 3/4 water in a spray bottle and make sure it's in a spray bottle that's labeled EPA registered hospital grade disinfectant. Wipe everything down. Make sure you take your product bottles after use. And this is something I try to get my students really on top of. If I'm doing a demonstration, for example, I usually enlist their help when I'm done. Let's say I did a microdermabrasion facial or something with a peel or whatever, and I've got all my product bottles behind me. I'll say, okay, y'all come over here before we put everything back in the cabinet. I want you to take a disinfectant wipe and we're going to wipe down each bottle before you put it in the cabinet, right? So that's extremely important. And I want to make sure y'all pay attention to that. Don't just put things back on the shelf or put things back in your cabinet without wiping it down. That is so key. You put your fingers all over things, and it's just one of those things to think about. Then mop at the end of every day, mop the floor if possible. Of course, we want to make sure that we use, a vacuum for carpeted areas, but disposable floor cleaner can be used. Keep that in mind. Cleaning linens. Bleach. I get this question a lot from my CEU providers. May I use organic, detergent to launder my linens? The answer is unfortunately no. Commercial use is the reason. We're performing services on the public. You have got to use color safe bleach as your disinfectant. Remember, you've got your quaternary ammonium compound, sodium hypochlorite, which is household bleach, and then phenolics. Those are your 3 disinfectants. So bleach is a registered disinfectant. You can use the color safe version, launder all day long, you're good to go. That's just how it has to be for commercial grade use, right? Then place the linens in the dryer immediately. Okay, and you're supposed to dry on hot too. That is actually not here, but on the LLR website, you dry your linens on hot. Do not leave the linens in the washer overnight. I would highlight that, underline it, whatever. That is so important. And we have a custodian now. His name is Carlos, and he is phenomenal. We love Carlos. But one thing that I've had to educate him on, I said, look, I know you're used to doing custodial stuff, right? But we have to comply with LLR stuff. You cannot take a whole clean bin of linens or towels and just leave it. Okay, you're either going to fold it and put it up or leave it in the dryer until a student or yourself can actually stop what you're doing, fold everything, put it in the closed container. You cannot leave clean linens out in the open for things to just settle down on top of. I'll say that one more time. You cannot leave clean linens in a ball, coming out the dryer in a basket, just sitting there until an hour or several hours later when you have the time to fold it and put it in a closed container. That's not how commercial laundry should ever work. It's not how it should work at your house either. So keep that in mind. Make the time, follow through, put it in a dry container that is labeled or a storage cabinet. Okay, then storing, fold the clean linens, place them in a storage container that's labeled. Uniform, wash uniforms nightly. Multiple uniforms or smocks will be needed if laundry cannot be performed daily. I'm gonna check the chat real quick. Yes, water catch tray, Faith. I know you know about that. Okay, real quick, where it says uniform, make a notation on this one. And I wish I had one here, but I don't. We were able to get from Amazon some disposable smocks, okay? And we wear them up in advance mostly. And that is because there's blood spill. Okay, there's blood spill that happens with a lot of those kind of procedures, but I'll tell you, you should probably wear them anyways. That is a suggestion, of course, not a requirement, but a suggestion to wear disposable smock. I think we got, the packs of 1,000 for just a handful of dollars, and they're disposable. So it's like a little apron, goes over your scrubs, and then you dispose of in between every single client. So that's important. If you have any questions, shoot me an email. I can send you the link to that. If you're interested in adding to your PPE and doing some disposable smocks, I think that's important. Okay, then this is the last part, and then we're going to move on to the next section and get going here. Okay, all right. So guidelines for students testing positive for COVID-19. I would put a guideline out there for your shop that says guidelines for employees, because what happens when you're the leader is that people don't take consideration for what they should do for their own health. Sometimes they will always look to the leader and they'll always say, well, what should I do in a moment of panic, right? So here's what you need to tell them, and you need to have this in writing, just like this. Student or employee must put in writing to the school or your business of their positive test for COVID-19, any documentation from a physician diagnosis, and disclose the following information. So this is important. Individuals, the student has been in contact for a lengthy period of time during the dates of attendance or during the dates of employment, because you need to make sure you try and notify who they were around, right? So that's important that you can notify. Of course, if it's someone that you don't even know, it's outside of your business, that's their responsibility. Where the student thinks they may have obtained COVID-19 from, who they've been around, blah, blah, blah. Information regarding first onset of any symptoms. Some people right now are asymptomatic, right? With COVID-19 positive tests, but some are actually symptomatic. So make sure you gather all that information, print that for their HR record. Everybody hiring employees should have an HR record for that employee. Or if you are having, if you have room renters, you should have a folder for every room renter, right? That's a whole other lecture for compliance items needed for room renters versus W-2 employees. But if you want that information, send me an email and I'll shoot that over to you as well. But make sure you place all this stuff in for your proof documents. Then student will be unable to return to school, or of course employee unable to return to your business until formal written documentation has been received by diagnosing physician that the student is able to return to class. That's a serious, serious thing. Luckily right now this year for us, we are lucky enough that the LLR, Board of Cosmetology, has approved digital learning to an extent, right, during this year until December 31. I'm hoping they'll extend that out into 2021, but we'll see. So if somebody presents me with a physician's note, I will give them digital learning assignments to complete for clock hours. So that's a wonderful thing. We're able to do that, but most certainly do not come on site. Don't come to our campus, stay away until you are free of these issues. And it's as easy as that. And it's worked really, really well. Okay. Then the student can be placed on a leave of absence. But of course, if they give us the physician's note, we'll give them digital learning, all that good stuff. And for you all, if you can put your employees on some sort of virtual something with your clients. I know Deidre Harvin's on this, and Deidre Harvin is one of the most incredible people I know. She actually offered up her time to showcase to our teachers how to do virtual consultations and skincare education for her clients. And she has done that successfully all year. And I think that is so incredible. If you know Deidre, connect with her for sure. Very giving person. But anyway, these are just some good things. And then the last thing here is guidelines for classmates, or for you all employees or coworkers, right, that have been in contact with a student or a client testing positive for COVID. It's heavily encouraged that all students take measures to receive testing if they believe they have been in close contact with someone that has tested positive. Here's what I want to add one step further. I called my attorney, Carl Hiller, over at Finkel Law Firm, and I asked him months ago when this first started. I said, okay, shoot it to me straight. I said, can you make someone go and get a COVID test? And the simple answer is no. You cannot legally ever make someone go do something to their body that they do not want to do. Okay, so that's something to remember. But it is heavily encouraged, right? So if you know someone has been in contact with someone that is tested positive for COVID, you need to heavily encourage them that they go and get tested. And I'm sure they will want to get tested, but I think that's just important to state. You cannot require someone to do that. I think that's good legal advice there. Then last 2 points is the guidelines state above. All students will receive temperature testing daily prior to entering into class. We talked about this at the beginning, and are to wear face masks when serving clients or students. Again, this can be twisted around to employees in your spa. When in the theory classroom setting or when not serving a guest, students must use sound judgment regarding face mask wearing, and it's highly advised that they be less than 6, or let me reread that again. It is highly advised that students wear face masks when being in close contact of less than 6 feet. Most certainly. Same with your employees. Everybody needs to wear a face mask at all times if in close contact less than 6 feet. Then, if students at SEI feel uncomfortable being in class due to receiving information that a classmate is tested positive, the student must inform the school and plan to follow regular guidelines and all of that good stuff. So my whole point is, if you see this entire thing, I highly recommend that you all add this to your website, put it in your own words. And then the website for this is seaesthetics-institute.com/COVID-19-written-plan.html. Or if you go, I'll show you one more time and we'll get back to our regular stuff. Go to the homepage of our website, hover over About, click on COVID-19 written plan, and that's where you can find this. So again, please feel free to use it. Please feel free to use it. I'm going to check the chat box one more time. No more new things. Okay.